is M. Prasad Naidu. Today we will discuss about the diabetes mellitus. First of all, what is diabetes mellitus? Diabetes, this is which is the body does not produce the properly use insulin and leading to a hyperglycemia condition, carbohydrate insulin secretions. So some of the conditions what goes to wrong in diabetes. So what are the wrong in diabetes? Multiple mechanism here. We are talking about the insulin regulation, secretion, uptake or breakdown, and beta cells damage. What wrongs? So action of insulin or on carbohydrates, proteins, and fat metabolism. Carbohydrates are facilitates the transport of glucose and muscle and adipose tissue. It facilitates the conversions of glucose to glycogen for a storage of liver and muscle. Decreases the breakdown of releases the glucose form to glycogen by the liver. So how it means the action of insulin proteins means proteins stimulate the protein synthesis and inhibiting the protein breakdown and diminishes the glyconeogenesis. So coming to the fat metabolism, it stimulates the lipogenesis and transports the triglycerol to adipose tissue, inhibit the lipolysis and prevent the excessive productions of ketones and ketoacidosis. Then we are talking about there are two types of diabetes mellitus, type 1 and type 2, majorly two types, and gestational diabetes also, mature onset diabetes also is seen in children. There are a lot of diabetes, but coming to we are talking about type 1 and type 2. Here is type 1 is the diabetes is here we are talking about type 1, low or absent of endogenous insulin and dependent on exogenous insulin for life, and the onset of generally less than 30 years age, and 5 to 10% of cases is diabetes. Onset sudden is symptoms is polyuria, polydipsia and polyphagia. These are the three phases, that is polyuria, polydipsia and polyphagia. Type 1 is a genetic component to disease. So type 2, coming to the type 2 diabetes mellitus is type 2 is insulin level may be normal but elevated depressed, characterized by insulin resistance, diminished tissue sensitivity to insulin and impaired beta cell functions and delayed the inadequate insulin releases. So often occurs more than 40 years. So type 2 is some of the risk factor family history and second sedentary lifestyles and obesity. Also aging is the major factor. So controlling it is controlled weight loss and oral hyperglycemic agents and or insulin. So screening for diabetes. So what are the screening methods? Fasting significance and actions of blood glucose more than 126 fasting blood GTT glucose tolerance test more than 126 diabetes mellitus. We'll know we'll confirm in fasting condition GTT will detect done the GTT means glucose tolerance test more than 126 milligrams per day means. So we'll confirm the diabetes mellitus. Carbohydrate counting. So as a serving carbohydrate is considering 15 grams. A serving the fruit or starch, 3 serving vegetables equal to 1 carbohydrate. 1 milk serving is considered to equal to 1 of the carbohydrate. So carbohydrate for example meal plan and 9 carbohydrate serving and 4 fruits is 5 starch or 3 fruits 4 starch plus 3 vegetables 1 milk, 2 fruits 4 starch and 3 vegetable and 2 milk. So how daily plan is we'll take up the daily meal plan is the timing is 8 to 8 a.m. means early morning morning breakfast, carbohydrates choice and meat is exchanges and fat is exchanges, and 10 p.m. means 10 a.m. means carbohydrate choice, and 12:30 p.m. means that in the afternoon carbohydrates is a choice and meat exchange fat exchanges. So minuses some of the conditions minuses, and 6:30 p.m. means carbohydrate some of the choice and meat is exchanges and fat also exchange. 8 p.m. means must will take the carbohydrate sometimes. So some of the condition about the gestational diabetes mellitus and matured onset of diabetes mellitus seen in young adult children. So several diabetes conditions we are talking about. Today we are talking about the type 1 diabetes mellitus and type 2 diabetes mellitus. So these are the conditions how it will to confined test is glucose tolerance test more than 120 milligrams per day is confined test. So fasting blood glucose is accurate. I think fasting and postprandial random blood glucose. There are 3 types of blood glucose levels. So we'll know the first of all fasting is will confine the And some of the three phases, the three P's are polyphagia, polydipsia, polyuria. These are the three conditions we'll find out in these conditions. Thank you.